Frustrated crowds bang on the windows, shouting at the Ebola response teams arriving in SUVs at the Rampara Health Center. "We want our colleague's body. Ebola doesn't exist," some shouted. Misinformation and skepticism in science is widespread here. In recent days, isolation tents were set on fire, healthcare facilities attacked by friends and relatives and local militias. During the attacks, some infected patients fled, further complicating the effort to contain the spread of Ebola across Ituri province, the epicenter in the northeast corner of the Democratic Republic of Congo. This is the DRC's 17th Ebola outbreak in the last 50 years, but even with that history, the rising death toll sows mistrust. Of the 5 million people living here, a quarter already require humanitarian assistance, and 1 in 5 already internally displaced due to decades of ethnic conflict on the eastern border with Uganda and Rwanda. People are really traumatized by the war, the insecurity, and now the disease, a local church leader tells us, asking for anonymity for fear of retaliation. "We hope aid arrives quickly," he says, because if Ebola enters one of the many refugee camps, it will be a catastrophe. Humanitarian aid is arriving, but not quickly enough, according to organizations on the ground, the global response still ramping up. Volunteers are on the front line in hazmat suits, supervising safe burial practices, a dangerous transmission point, experts say, and Congolese Red Cross workers going door to door, sharing information about how Ebola is spread.
We need to ensure a coordinated approach to this, filling the gaps, making sure that the needs are covered, but we cannot also forget the underlying conditions that were already here.
Underlying conditions that make this rare strain of Ebola harder to contain than previous outbreaks. The WHO's Director General is on his way to the DRC today with a stark warning to African leaders. At the moment, Dr. Tedros said, the epidemic is outpacing us. Unlike the more common Zaire strain, there's no treatment, no vaccine, and it comes at a moment when international investment in global health, including from the United States, is significantly down.
For the health sector in 2025, there was a 70% decrease into the international assistance.
Health officials like the WHO's Dr. Anne Ancia, who works in the DRC, says they're playing catch-up. The virus likely circulated for weeks before the outbreak was declared.
We don't yet know the full extent of the outbreak. And now it is very difficult. We're running behind the outbreak. We're not yet, trying to control it.
Still working to break the chain of transmission, a massive challenge in an already unstable region. Molly Hunter, NBC News.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.